Okay, so when your patient comes in for a coronal polish, after they've been seated in the chair, they've had their health history reviewed, their vital signs are good, and we're getting ready to do a coronal polish. The first thing that we want to do is we are going to check and we're going to chart what we see in the mouth. So basically just charting missing teeth, if there's any porcelain crowns that we don't want to polish, just things like that. So we're just taking our look there, and your assistant's going to chart for you as to what you see. Okay? After that, the next thing we're going to do is apply disclosing agent. This is just vegetable dye, so it really has no taste, but you want to be very, very careful with it because it stains very easily. All right? So I want to always make sure that my patient's teeth are nice and dry. So I usually just have my patient swallow really good. And then you're going to dip your Q-tip in here. And I'm going to retract with my mirror so that I don't get it all over my gloves. You're going to retract. And then you're just going to start at the gum line on the posterior and you're just going to apply. You don't have to paint each tooth. We just want to get it right at the gum line. So if you see here, I'll pull back right here so you can see really well. Right here. So if you push down, it kind of goes interproximal there. So we're just going to go on the facial and the lingual area. So this is going to mark where there's plaque. So you want to make sure that you get it everywhere that you need it. And then we'll go to the mandibular and you're just going to come around, mark it, and then back on the lingual. Okay? After we go ahead and disclose, then we're going to rinse the patient. So your partner will put in some water, and because of COVID, we're going to just add water to the patient's mouth, let them swish, and then we'll suction. That way we're not spraying air and water. So we'll give our patient some water right in the corner of their mouth. Here. Have the patient close down, swish, and then we'll suction the water out. Okay, I'm going to rinse him off since he can't swish. And on your patients, it's going to mark where the plaque is. Now that's kind of a little bit of cheat because it's telling you exactly what you need to remove. There we go. He doesn't mark much because he doesn't really have plaque. Okay, at that point in the procedure, then the instructor will come over and switch with the operator, and we'll go ahead and chart where we see plaque. Okay, so that will be our starting plaque index. All right, after the plaque has been charted, then you're going to start your polishing. It's very, very important to make sure that you guys are understanding that we are not scrubbing the teeth. We're not doing this. Our prophy cup spins for us. Okay? So we want to make sure that we are, I'm going to start here just to show you. You want to make sure that you are getting the interproximal. Okay? So you're going interproximal here, straight up, interproximal. Okay? Fulcrum wise, remember your fulcrum is going to be intraoral with your ring finger as close to the working area as possible. So we could go here for the posterior. We're going to turn to the anterior here. Make that patient move for us. We're going to polish back here. Come back lingual. Okay, then we're going to come back down on the mandibular. Patient turns away from us. And remember, 1 to 3 teeth for your prophy paste. So when you come in here, you want to make sure that you can see. So sometimes you have to adjust yourself. And then we turn at the canine. So again, I'm going to show you here. I'm really choked up on my prophy cup here. So I'm getting that interproximal, that straight up facial, that interproximal. Okay, again, interproximal, straight up facial, interproximal. But I'm picking up in between, kind of swiping that. You don't want to do this on the tooth. Now we're scrubbing and we're heating up the tooth. We're going to cause damage. So you want to pick up. Okay, so after we do the polish, then we're going to do flossing. After we do our flossing, then we're going to rinse the patient again. Again, put the water in the corner of the mouth, let him swish or her swish, and then spit it out. At this point, you can go back and look if there's any areas that you think you've missed. Okay, so we're going to give him some water. Go ahead and swish that, and we'll suction that out for them. Now, this is your opportunity to take a look. With your mouth mirror, go through and look and see if you've missed any areas. If you've missed them, you can go back and get them. Okay, so I'm going to look. So if I see some purple still on there, I'm going to go ahead and go back and spot that out and remove that before I let the instructor know that I'm finished. Now that's within a time frame, so you have a certain time frame. You can't do that if you are not within the time frame. After that, we're going to go ahead and have the patient swallow. We're going to put the disclosing solution again. We put the solution just like this, right at the gum line, all the way over, back on the lingual, on the facial, back on the lingual. Rinse our patient. And then at that point, the instructor is going to come over and we're going to chart the remaining plaque. That remaining plaque needs to be less than 75% for you to pass. Okay, so that's our goal of coronal polish.